We're going to transition into some other treatment now, but I just wanted to show you the Galaga, the foosball, micro fridge. There's the cassette. Actually, you can't quite see the cassette tapes. They're back here, CDs.
Oh, yeah.
The bar looks great, and there's that TV VCR combo. So
totally 80s.
Yep.
Yeah, I was a Galaga champion of Carthage, New York, man, for a long time.
So was I.
No, I love Galaga.
I'm not sure I've ever played it.
Oh, dude.
I'm
So,
on
your back. Yep, on your back. So we'll do the same thing here again. Yeah, Galaga's like the best game, better than Pac-Man and all those things, man. It's totally. You can keep all these Call of Duty and stuff like that, man. It's all yours. You gotta have Galaga.
Yeah, I'm a more of a basics guy myself.
My wife and I, we just got out Miss Pac-Man the other day. It was on. I'm like, oh, we forgot all about that. All right. So gray is your ground. So now what we're going to do is we're going to come in here. We're going to use this bracelet. So now I'm going to take your palm up for me best you can. Yep, you just relax here. Let's let that arm come back. So now in this position here, I'm going to go ahead and take the bracelet. And where'd that tool go? Did I bring that over?
You did have it.
I had it just a second ago. Multi-tool. Oh, I'll find it in a second. All right, here.
Did it go in a pocket?
No, I just thought I brought it over. So now we're going to use the multi-tool from Hawk Grips right here. It's a great little multi-tool. We're going to go ahead and get into using this bracelet. So what this bracelet does now is it's going to transfer the current, not through that pad where we did those pads a little bit while ago. Now it's going to transfer the current through my arm into the tissue we're using here with you. Now we can use the tool and stuff like that. So now we're going to get specific right along that bicep. So.
And you want my palm up, you said?
Yeah, you can scoot it just a little bit that way, Jed. I want to bring your arm out a little bit farther. Perfect, right there. So we're into this tissue now and use a little of this conductive gel here again. We want to use a little more of the conductive gel too because we want the electrical current not to create any hot spots. So here we are. So now it automatically senses and starts up the machine. So now I'm going to go ahead and get right specifically into some of those structures where I want to get in on a little bit here. So I'm going to work right down. So now it uses the tool. The electrical current is going to go down through my arm, through the tool, into the tissue. And we've got it set up at about 30% right now. And a lot of times you'll see in guys like yourself this deltoid tuberosity here, this bicipital groove here. And this deltoid pectoral space right here gets really, really tight. So again, a lot of times these structures up front become hypomobile or stiff and shortened, and the ones posterior become lengthened and inefficient. So the thing that's great about this here now too is I can go ahead and use my fingers to get right up into that. So I don't have to use the tool, but I can. I like to get in there. So using my thumbs. And then you can actually pin and shorten these here. So I'm going to pin, let's go here, and then lengthen that out.
My massage specialist or whatever does something very similar to this when she works on my arm.
Oh yeah?
Yeah.
Massage therapy is great. I think massage therapy is great. It's a great allied health profession. They really get into it because that soft tissue holds so much tension.
Yeah.
And so much restriction in there.
Where you were just, the patterning that you were just doing is exactly where the pain was.
Oh, really?
Yes.
Yeah. So we'll go back to that in a second. So if you can put the extremity in a position that is reproducing the symptoms, you can then try to kind of find that.
That's great.
Yeah, area that's going to help to kind of relieve that. And, you know, a lot of times you'll see this petechiae, this little bit of blood vessel breakage on the superficial skin and stuff like that. And some areas that are more hypomobile or don't have enough blood flow to them and stuff like that too as well. So
sure, I guarantee there's restriction going through there.
If this is too much, you let me know.
Nope.
And then you can kind of come right in here. And when you go to, I'm going to go to a smaller area now here. And I'm just going to go right along that biceps tendon. And you can try to rock and even move along that area.
Like a pizza cutter almost.
Yeah. It's hard to get to that tissue, but. And then once we mobilize, we're going to move. We mobilize. We're going to go in some soft tissue mobility, some capsule mobility stuff here, and we'll do that next. Okay, bring your arm across here for me. So now I'm going to have you keep it there just like that.
Okay.
So I'm going to come across here, and now I'm going to pin that, and then let's go out this way. So come up here. Pin, stretch that. Pin, stretch that. These sternal fibers of the pec and stuff like that don't get enough love a lot of times, do they? Really.
And that's where I was really having the issues where the inch bell was hitting my chest.
Yeah.
It was so swollen, dude.
Yeah.
I basically had to stop. That's why I haven't. Anybody that watches my channel, they haven't seen any of that in months, and it's because it was hurting my
So much.
Yeah, because I was being successful with the cleans, left-handed, but and I haven't this whole year. I haven't completed one right-handed, but along with the completions, there were also failures that were just maybe reaching 2 inches too low,
Right.
and it was just smashing my pec and my collarbone. It was just terrible,
Yeah, that's got it. And I've seen beforehand where we're gonna get up underneath that pack a little bit too. Come up this way. I felt that there for a second.
Yeah.
Is that what you're getting there, Jed?
Yeah, and it hasn't been happening too much. Basically, the only time the clicking happens is when I'm stretching.
Yeah.
So I'll do those doorway stretches, and then as I bring it down, it clicks. But it used to be that it was like substantial pain to bring it down.
Yeah.
Out of that position. So at least that's not happening anymore. So in my opinion, it seems to be dramatically improved.
A lot of times it's just not continuing to aggravate over time. You can still, and this is the time where you can work on stability exercises instead of getting into those areas. So people think they have to work through it, but that's not true. You just work differently. You work in the area that doesn't reproduce those symptoms and helps to mobilize that tissue.
Yeah.
Okay, bring yourself back over here now. All right, so let's pause this. Let's take this off. So now what we're going to do is we're going to try to do some manual stuff right here. And I'm going to try to mobilize that posterior part of your shoulder.
Okay.
Yeah, I had a friend of mine moving. It's like I don't have anything going. Didn't have anything going yesterday or tomorrow.
Yeah.
It's like today everything's going on.
Yeah,
Like
yeah.
a friend of mine's moving, and then you're like, hey, can I come up a little earlier? I'm like, oh, that'd be great. I'm like, I got to head out of here.
Yeah.
And got me out of moving too.
Cool.
So okay. So the next thing is we said that posterior part of your shoulder is a little restricted. We need to get that moving a little better right there. So we're going to do a manual therapy technique. We're going to bring your arm in here in this position here. I'm going to do a posterior shoulder. Put your hand on your stomach for a second. Relax your arm. I'm going to come in here at your humeral head. We're going to do what they call the arthrokinematic method, and we're going to grab and we're going to spin. Try to internally rotate your shoulder girdle. You relax as we come back in this position, straight arm, and I'm just going to go ahead and we're going to try to mobilize posterior, a little slightly lateral, and see if we can get some better mobility.
Yeah, I can feel it like, I'm going to say tractioning.
Yeah.
The separation.
Yeah.
I can feel it, and it feels good.
So that's what we're going to try to do. So you see that Donnie Thompson does a lot of this stuff with some of his band work and stuff like that.
I was going to bring that up.
Yeah.
Yep.
So it's just a different way of doing it. So there's multiple different ways. This is a way I've learned through the International Academy of Orthopedic Medicine, IOM. And so there's just we'll get this posterior superior capsule a little bit, and we'll hold that, and then we're going to do one across the body here in a second, and then we're going to stretch, and we'll see if we can get this going. And you're a big dude, so it's a little bit higher. And usually you can have a high-low table we can work with. So I'm overreaching right now. So we'll come back this way. Let's come across now. Now this way here.
There's definitely some tension in there, dude. I really feel it.
You're going to come across this way. Pin. And now you just relax. And I'm going to mobilize with this hand here. Yeah. So this one's going to go posterior. Here. as we do a crossbody stretch. Deep breath, relax. Need big hands to work with you. Deep breath and hold, yep. I'm just going to keep that there. So grade 3s, we're going to take it through the resistance. On the opposite side, go to the resistance, little oscillations. Grade 4, static hold. I'm just going to hold that there. And then let's do this here for a second. Let's lay on your side that way. So lay on your left-hand side like you were doing that for a second. Let's see if we can get a little bit more range of motion out of that. So there's a lot of debate about the modified sleeper, the sleeper stretch, and there's a modified sleeper stretch. So when you do this, you will come on your side. You want to pin that shoulder blade, that shoulder girdle down. So then when you come back into this position, here's a nice little thing I do. I like it, but some people don't like it, especially if you have an anterior biceps issue right here, because you can be in a high five position and you cause an impingement right here. But we all impinge, as long as there's no pain that's associated with it. So now we're going to go in here and just see if we have any better motion.
Definitely.
So it looks like we got some better motion right here, with just that little bit right there. So then what I'm going to have you add to it, not just a sleeper, any pain with that at all?
A little bit.
Are you feeling anything? Are you feeling back here?
Yeah.
So what we're going to do now is we're going to add a contract and relax. So what you're going to do now is you can feel, put your hand where my hand is at. Put your hand, yep, there. So you're going to pull it, you're going to push until you feel a little discomfort. Then you're going to contract and move the opposite direction. Don't let it move though.
Oh.
Yeah, so can just iso hold, contract, hold, relax, take it a little farther. So that contract and relax. So now push into it, contract, relax. See if you can take it a little bit farther. So now we're getting that posterior capsule, or we're going to posterior superior, posterior inferior capsule back in through here. So another way is if you do get that pinch a little bit front, you can lay a little bit on your back and bring the shoulder down a little bit farther in this position. You know what I'm saying? You might have to, if you want to do that, you can bring it down and come in this position.
That's sensitive.
Okay, yeah. Just make sure if it causes you pain, then you don't want to do it. You don't want to work through that pain. So, all right. Cool. Let's pop back up here for a second. So now
Sitting?
Yep, sitting. Yep. Now what we're going to do is we'll do a sideline external rotation.